Thank you, Alison, for hosting us. And my name is Jose Navarro Betancourt, and I am the scientific director at Quadrascope. So Quadrascope is a venture capital fund based in Boston, and we invest in longevity healthcare. Now, you all know this. Longevity healthcare is all about treating the root causes of disease, as Sonia mentioned. And the root causes of disease are these hallmarks of aging across the top. Now, there are surely more root causes of disease, and this is an ever-expanding science. But the key message here is that there are only a few hallmarks of aging, but hundreds of diseases. So each hallmark of aging can result in a number of diseases. For example, all these diseases you see here have been in clinical trials to be treated by managing cellular senescence. And the list on this side can be attributed to chronic inflammation. Now, when longevity companies target one or more root causes of disease, they can choose from any number of diseases to get to market. And for example, many would agree that the first family of modern longevity drugs has already arrived. And they are already blockbusters. This family of drugs is the GLP-1 receptor agonists. And an example is semaglutide or Ozempic, Wegovy. And we have all the elements of a longevity drug here. We have treating multiple indications. We have being approved for disease prevention. Prevention is a key word here. And most importantly, being treating a root cause of disease. It seems that the root cause of disease here goes beyond obesity. It's probably related to metabolic dysfunction or inflammation. Everything converges in inflammation. But there is a problem here. The problem is that around 30% of the weight lost with this family of drugs is at the expense of muscle mass. It is at the expense of muscle loss. And obviously, this is not ideal for longevity because muscle is a metabolic organ. And because the older you get, the older you are, the harder it is to gain this muscle back, right? So, but we have a nice story on the horizon targeting this problem. A story about one of our portfolio companies, Immunis. Immunis recently completed a phase 1/2A clinical trial treating muscle atrophy. The complete results are going to be published next year, and preliminary analysis indicate that the treatment is safe and probably effective in preserving and even building muscle. They also discovered that the same drug can also treat obesity. And they got a big pharma partner to help them design a phase 2 clinical trial on obesity, sarcopenic obesity to be more precise. This trial just got FDA clearance to start recruiting patients. And actually, it also got non-dilutive funding from a network of longevity clinics based in the US that offered to run the trial at their clinics in order to make this drug available to patients. So this is essentially non-dilutive funding for Immunis. Immunis' drug, Immuna. Immuna is actually a secretome of immune system progenitor cells that contains over 400 components that together fight chronic inflammation very effectively in a way that a single molecule cannot. Some of these components are growth factors, exerkines, and lipids. We also have another story from the real world, from the portfolio, is BioChange. BioChange found a way to regenerate the extracellular matrix, which, as you know, is very challenging to do, very challenging to repair or regenerate. They created a biomaterial that mimics the embryonic extracellular matrix. And embryonic is a key word here because when cells find this matrix, this is a signal to them to build tissue, like they did when they were in the embryo. And BioChange entered the veterinary market earlier this year. They are treating dogs with periodontal disease or receding gums. And the key highlight here is that the same biomaterial can help regenerate two types of tissue, bone and soft tissue. And this suggests that cells know what they need to do if they are presented with the right matrix. And this opens the possibility to do more complex regenerative approaches like what Mark and John were talking about earlier today. And obviously, they are targeting human periodontal disease next, but there is a range of conditions to which this technology can apply to. Now, this is our entire portfolio of 14 companies solving aging. Our portfolio is well diversified across the hallmarks of aging and includes a mix of clinical and preclinical companies. Our portfolio has a small markup, even though the fund is only 1 year old. But the real indicators of success are these partnerships and collaborations with big pharma companies of our portfolio companies. These partnerships really attest to the market viability and the solid scientific foundation of our portfolio. And we have built this portfolio thanks to our wonderful team. I don't have enough time to do them justice right now, but Reason from Fight Aging and Repair Bio will speak later today, and Robert Cargill, I don't see him, but Dr. Robert Cargill is here as well. Our fundraising window is ending next March, and we are open to new limited partners. And thank you again for listening.
Awesome.